I'm Dr. Sara Malik, and as a urologist, I've seen the toll that health concerns take on men's physical and mental well-being.
Intimacy is a cornerstone of human connection, yet for many, achieving mutual satisfaction remains a complicated, often frustrating puzzle. Why is it that something so natural can be so elusive? The truth is, female pleasure is often misunderstood, oversimplified, and rarely discussed with the scientific clarity it deserves. The result? Unmet needs and lingering disappointment. I'm Dr. Sara, and today we are going beyond the myths. We are diving into the proven doctor's guide to fingering techniques that actually work for women. This is an anatomical, neurological, and emotional roadmap designed to deliver maximum, reliable pleasure. We will explain the science, bust the myths, and share the techniques that truly matter. I want to share the story of a couple, Sara and Daniel, who came to me frustrated. They loved each other deeply, but intimacy felt incomplete. Daniel, like many men, assumed deeper, faster stimulation was the answer, a common but often incorrect approach. Sara confessed that she often felt overlooked. She needed connection, rhythm, and variety, not just one sustained movement. Daniel felt like he was failing. The pressure to perform was crushing his confidence, and Sara's pleasure was suffering. I introduced them to the principles: curvature, cadence, and communication. I explained the anatomy and demonstrated the effective angles. Daniel realized his approach was too linear. The hook technique, targeting the anterior wall, and the feather touch, external clitoral focus, were completely new to him. The transformation wasn't instantaneous, but it was profound. They started communicating openly, treating pleasure like a shared exploration. Daniel stopped viewing it as a performance test and started viewing it as a partnership. The doctor didn't just give us techniques. She gave us permission to explore and communicate. Daniel's confidence went up, and suddenly, the pleasure wasn't a rare occurrence. It became reliable, incredible, and deeper than ever. Step by step, technique breakdown. Technique 1. The feather touch, external mastery. Start outside. Use the soft pads of the fingers, not the tips. Begin with light, rhythmic circling or figure eights over the clitoral hood. This builds sensitivity and anticipation. Avoid direct focused friction. Less is often more here. Technique 2. The come hither hook, anterior wall activation. Once ready, the middle finger, or two fingers, can enter slightly. The key is to curl the fingers up towards the front wall of the body. Use a gentle come hither or hooking motion. Pressure, not speed, is the activator here. Technique 3. Cadence and contrast. Never maintain a single speed or pressure. Start slow, then increase the rhythm, then suddenly slow down again. Introduce contrast. Move from external, light touch to internal focused pressure. The contrast is what builds sensation and leads to maximum release. Expert myth-busting moments. Myth 1. Deep penetration is necessary. Many assume depth equals pleasure. This is biologically false. The deepest areas of the vaginal canal have the fewest nerve endings. Maximum pleasure is achieved in the outer third and by focusing on the clitoral complex and anterior wall. Myth 2. Speed is the goal. Rushing and aggressive friction often lead to discomfort, not ecstasy. The body needs time to build arousal and lubrication. Patience, variation, and establishing comfort are far more effective than trying to get there quickly. Myth 3. She will just tell me. While communication is vital, it can be intimidating. Don't just ask, "What do you want?" Ask, "Does that pressure feel good?" Or, "How does this speed feel compared to a moment ago?" Be specific. Treat her body language as your guide and ask open-ended questions. Educational breakdown, anatomy and sensation. To achieve mastery, we must understand the geography. Contrary to popular belief, pleasure is not focused on one small area. It is a vast landscape. We must focus on the primary pleasure centers: the clitoris, both external and internal, and the highly sensitive areas of the vaginal canal. The clitoral complex. Only the tip is visible, but the body extends deep inside. Stimulation of this area doesn't always require direct touch. Pressure applied near the hood or through rhythmic circling is often more effective than direct friction. It is the central nervous hub commanding sensation. The anterior wall and the Grafenberg spot, G-spot. Research suggests this area, located on the front wall of the vaginal canal, is highly responsive due to concentrations of nerve endings and surrounding tissue. The key here is not penetration depth, but the specific angle and pressure. The role of the brain. Remember, the largest sex organ is the brain. Building anticipation, ensuring comfort, and establishing trust are non-negotiable foundations. If the mind isn't relaxed, the body cannot fully respond. Techniques are tools, but consent and communication are the master keys. Mastery in intimacy is not about luck. It's about applied knowledge and connection. Use the techniques we've discussed, but always prioritize the emotional safety and clear communication. Pleasure is a shared experience, and now you have the proven guide to make it reliable and truly profound. If this guide has unlocked new possibilities for you and your partner, please share this video. Your willingness to learn and discuss this topic helps break down the silence around female pleasure. If you have questions about specific techniques, share them in the comments below. For more science-backed guides on health, connection, and intimacy, please consider subscribing to the channel. Hit the notification bell so you don't miss our next deep dive. Thank you for seeking knowledge.